good evening to everyone who has joined us. Thank you for joining us for our third live question and answer session. We are, and by we, I mean the Young Black Physicians, are hosting this live Q&A for our community. Tonight, we're discussing back to school and what you really need to know. My name is Dr. Elizabeth Johnson. I am a pediatric attending in the Metro Detroit area. And first, before we get started, we just wanted to do some housekeeping and some disclosures, and then we'll get right into the panel. So first of all, we are not receiving any gifts or payments from pharmaceutical companies, biotech companies, health institutions, or any other private or public institution for today's event. This event will be recorded for educational purposes. By participating in the call today, you're consenting to this recording and potential published educational evaluations. All of the information shared here will solely reflect the views of the panelists, and this will include the panelists' research of nationally available information, as well as the panel's own personal experiences. The views expressed in this video are not a representation of our associated institutions. This should not be taken as strict medical advice. All content, including text, graphics, images, and information contained on or available through this platform is for general information purposes only. As always, please talk to your physician or qualified healthcare provider for more information. The last thing before we jump into this, as you can see, if you aren't familiar with Zoom, there are two places that you can put questions: the actual chat and then the question and answer section. We would prefer, as we progress through the event, that we submit all the questions through the Q&A tab, and we will be answering throughout the event. So if you see us looking down, please excuse us. We're not ignoring or not engaging, but we're actively answering questions at the same time. Okay? So let's get started. First, I wanted to, before asking the panelists questions, read some information. Since we're doing a back to school special, I wanted to read some information that was provided on the AAP website, which is the American Academy of Pediatrics. This is some state level data that they provided for the public. So first of all, as of, and this was published maybe 2 weeks ago. So as of August 19, over 4.59 million children have tested positive for COVID-19 since the onset of the pandemic. Over 180,000 cases were added this past week, reaching levels of the previous winter surge of 2020 to 21 after declining in early summer. Child cases have increased exponentially, with over a four-fold increase this past month, rising from about 38,000 cases the week ending July 22nd to 180,000 this past week. And keep in mind, this was published on August 19th. The age distribution of reported COVID-19 cases were provided on the health department websites of 49 states, which also included New York City, the District of Columbia, Puerto Rico, and Guam. Since the pandemic began, children represented 14.6% of total of all the cases. And for the week ending August 19th, children were 22.4% of reported weekly COVID-19 cases. A smaller subset of states reported on hospitalizations and mortality by age, and the available data indicates that COVID-19 associated hospitalizations and death is uncommon in young children. At this time, it appears that severe illness due to COVID-19 is uncommon among children, but however, this is an urgent need to collect more data on longer term impacts of the pandemic on children, including ways the virus may harm the long-term physical health of infected children, as well as its emotional and mental health effects. And something really important to keep in mind with that data, it's what is actually submitted by certain states. And that, was collected from a certain time period. So just keep that in mind, that the numbers could actually be higher than that. So let's start off with our first question. And parents really want to know, what are the current recommendations for schools? Should their children be going back in the first place? What is being done? Well, actually, hold on, pause for the cause. I didn't even introduce the panel. I'm sorry, y'all. I got into it and forgot. So let's backtrack for a second. I'm going to start from my top left. We have Dr. Lauren Urota. She is a family medicine attending, also in the greater Metro Detroit area. We have Dr. Randall McPherson, who is a family medicine attending. We have Dr. Emel Okoye. Did I get it?
Yeah, you got it.
Who is trained in not only internal medicine, but pediatrics. We have Dr. Janelle Lee Allen, who is currently finishing up her fellowship in gastroenterology and hepatology. We have Dr. Cindy Agu, who is currently finishing her fellowship in neonatology. We have Dr. Nicholas Fletcher, who is a resident currently in psychiatry. And we have Dr. Guinea Ikwezuma. No?
Yeah, you got it.
Who is actually entering an OB-GYN fellowship right now. So thank you guys for our wonderful group of panelists for joining us tonight. Now, back to the first question. What do parents need to know? What are the current recommendations in schools in regards to COVID-19? Dr. Lee Allen, do you want to take that? You're on mute.
Let me just unmute myself. Sorry about that. So, the biggest things for COVID-19, as far as parents needing to know, is really about the importance of CDC recommending vaccination for every single body who is eligible for vaccination, meaning those who are over the age of 12 and older, as well as for those along with the vaccination, as well as all the masking mandates, essentially. Certainly, the CDC recommends for everyone to mask, regardless of your vaccination status, if you are indoors, or if you are in a very crowded outside setting, and your community or your region is actually in the substantial or the high category for transmissions, or basically infections in your area. And this can, that's something that you can easily Google or look up for what your city and state is. The CDC has fabulous information that you can just literally put your city and state in Google, and say, what's the transmission rate? And they'll be able to let you know. But again, regardless of anything, get vaccinated, mask up, continue to, do the same 3 W's: watch your distance, wash your hands, and wear your mask.
Anybody else want to comment on that?
I would say, as a mom who has a 5-year-old that is about to enter kindergarten, this is a very, unique time, because not only is he entering, real school, but we're dealing with very different guidelines and situations. And what I've noticed is that the schools are very diligent about getting all the information out in a very timely manner. I've never seen so many newsletters and updates and posts, and just superintendents, principals, teachers are very in tune with trying to make sure they are following the most up-to-date CDC guidelines. They want to be safe for their families too. They want to be able to do what their mission and passion is in life, and that is to teach. So they want to make sure that the environment is very calming despite all of this, going on, and also stressing to the parents that we have to be very resilient and flexible, because things are changing day by day as we get more information, that we do have to be very in tune with all of those things, probably more so than we were.
So another question that we had received, and I promise that we do see your questions in the Q&A. We're going to answer a few questions that we received previously right now, but are there differences between public and private schools right now with the recommendations?
I haven't noticed any difference. I have another friend of mine, she's a family medicine physician, and her daughter is in a private school. And so we compare and contrast, things that they're doing within the classes. And I would say that there's no difference as far as the overall goal,
Dr. Fletcher, did you have something to add to that? Uh-oh. We can't hear you. Take 2. Okay, go ahead.
I'll probably just get it. Okay.
Oh, wait, no, that was Dr. Okoye.
Oh no, it's fine. I mean, I think Dr. Fletcher is talking or trying to talk. I don't
We
know.
got it. We got it now. We got it. I apologize. I apologize. I was just simply going to add to Dr. Lauren was that, um, a lot of the information that comes down as far as, authority about, masking really starts at the county and local level. It's kind of a trickle down effect from, whether you're state, governor, but really, who you want to pay attention to is your local city, county health officials and what their recommendations are for masking. And that, in turn, will go down to the superintendents of schools and stuff like that. So, I would always say to patients, start local first. Find out who the people are authority in your city, and then go from there.
Dr. Fletcher, I think we're getting a little feedback on your mic. We can hear it a little bit.
And I just want to echo a little bit about what Dr. Fletcher pointed out, which is, while, and Dr. Uroda also commented on this, although, a lot of the information is coming from your state, local areas, it is quite fluid as the fall comes along. Realizing that a lot of other infections may be happening at the same time. So I think it's wise to, check back the CDC, of course, also the AAP, which Dr. Johnson mentioned earlier. Those are going to have the most up-to-date information, and realizing that, again, the information is changing daily. In terms of the local mandates that may be, which Dr. Fletcher was mentioning, those are going to change depending on what kind of information that is coming out at the local level. And so, keep an eye out for those things when you're checking your local news feeds.
So just to piggyback off of that, Dr. Guinea, what you just mentioned in terms of schools following the recommendations of their local health department, so on and so forth. What should parents do, or what should parents be aware of, and how should they move forward if their school is not following CDC recommendations? What should they do? What's the best advice we can give the parents?
Well, that's a good point. And I think Dr. Uroda, she commented, as a parent, Dr. Uroda, did you want to comment on some of that? I think.
Yeah, that's something that you as a parent can report to the health department. That is something, there's certain things that are mandated as far as, how many children per instructor, things have to be up to code. So if you are noticing that something isn't, then that is your, duty and obligation, to report that.
Yeah, and I'll just add to that. I think we should also recognize that we, I say we, but for parents, they do have a lot of power, and they should know that if they are seeing that there's something wrong and it's not something that's safe for their child, they should not only bring it up. One, try to address it directly to the administration and see if they do have things in place that you may not have been aware of. But if you're seeing that there really isn't anything that that they're doing, in your opinion, that is protective for the children, then yes, you want to look out at extra individuals outside of that area. I would suggest also linking with other parents. I think getting individuals together, because if you're thinking this or you see this as an issue, there's likely that someone else sees it as an issue as well. So try to rally together a group of people and try to make it known, find out more information from your local health department, figure out what the actual requirements are. And then, yes, you can supersede your particular school and go to the general education body, whatever group they answer to, those you can raise up your concerns to.
So that actually, thank you, Dr. Mel, that answers one of our questions that we were receiving from the audience. Fatima said, as teachers, what questions should we ask our administrators as far as the 3 feet and 6 feet apart in classroom? And something that Dr. Amel is really saying is that our teachers and our parents have voices. So be your child's advocate and go to your superintendents, go to your principals, and really make your concerns known and ask, what are you doing? What are we putting into place, not only to protect the children, but we want to protect our teachers too.
So, and I'll even add to that, if sorry to interrupt you, Dr. Ekwezin, but just to jump off you, Dr. Johnson, with that same question, I mean, we want to get specific questions, because there is, of course, we know that they have that 3-foot distance in place. Just because they know, well, what we see is that the viral spread, as far as in the respiratory droplets or in the particles, are not as far among children than they are with adults. So they kind of give a little bit of leeway. And also, to be realistic, they don't have enough space to be able to separate all those children for 6 feet. So there are going to be some situations where you won't be able to see these things fully put out in practice. So like considering a lunchroom, considering, I mean, the bathroom, they should be able to work up, but certain situations you may not see that. And so you want to figure out what are they doing in addition or around those situations to help to balance those issues. So for example, ventilation then becomes, you have to have layers of the protection. So ventilation becomes an issue. Is it an area that's fairly ventilated? All right. Is it an area where, is in a position where, you have, generally most people are vaccinated? All right. Is there staggering of the classes so that they're not all the classes are coming in and lunch at the same time? So those are some specifics that you can try to ask. But I mean, we have to understand that there are just certain situations, especially with specific schools, because every school is going to be different. But there are just going to be situations where we cannot be 100% with the mandate,
right?
Recommendations.
And this even kind of highlights why wearing a mask is so important too. With that aerosolization of the viral particles, having some type of barrier, whether it's like the mask that you may see, that with the blue mask that you may see your physicians wearing sometimes, having that kind of mask, or having some kind of cloth, appropriate cloth barrier will prevent that aerosolization from occurring. There was a situation where a teacher that was unvaccinated, she was standing within close proximity to the students, and she actually ended up passing, COVID to some of the students. And so, this just kind of highlights, why doing those things that Dr. Lee Allen recommended initially, wear your mask, wash your hands, especially with the fall, as Dr. Johnson and Dr. Agu could probably, being the pediatricians and the neonatologists in the group, they can attest to, having younger children, they carry a lot of germs inherently just from their interaction. So you want to make sure that they're washing their hands and trying to have appropriate distancing with their friends.
That's a great point, Dr. Gainey. That actually leads into one of our other audience questions. Rachel asked, shouldn't schools be using sanitizer for children's hands as well? So the answer is yes, but we also want children, the thing that you can do as a teacher and as a parent is teaching your child from an early age how to wash their hands. If you look around, there are adults who don't wash their hands properly. Let's just focus on washing our hands, and the kiddos love it. Add a song to it. If you add a song to anything, a 3 and 4-year-old would do it. Yeah. Okay. I told a child the other day in the office, they were resistant to washing their hands. Sing the ABCs slowly, and that will get you to 20 seconds. So yes, it will be great to have hand sanitizer in every room, but if not, just going back to the basics of washing your hands and washing your hands well.
I just want to also add that I love that. I remember teaching my kids that when they were quite younger. But I think there's also a question in regards to high school students. So I have high schoolers. And the truth is, I think what Liz is saying is absolutely the golden rule, right? We can't, unfortunately, we cannot control everything that happens outside of our own homes or outside of our own selves. But educating your children, having your own child go with their little, the little miniature hand hand sanitizers that can loop onto their belt, or if they're old enough to have a purse or whatever, making sure that they understand, how to make sure that they're washing their hands, making sure that they have extra masks in their book bag or whatever in their belongings, because we know that sometimes those masks, the little loops pop and break. In addition to that, if you're in a facility where they're not mandated a mask, that's the same way it's going to be, right? When we go out into the grocery store, there's no, sometimes for some of us, there's not a mandate there in some different stores that we go to, but knowing how to protect your own self and teaching your child how to protect their own selves. Knowing that if you're in the grocery line or if you're in the, lunch line, and it's a little crowded, knowing how to stand back a little bit, knowing how to, maybe for the sake until you feel safer in your district, if your district is not having a mandate for masks, how to allow your child to pack their own lunch so that they don't have to be, close to where they have to get the food at. In addition, I think even there's a question about the extracurricular sports. The rules still apply for extracurricular sports. Certainly, if it's outdoors, they can enjoy, being outdoors and playing their sports. But when they are off of the actual, field and they are sitting at the sidelines, particularly if they are too young to have been vaccinated, everybody should be wearing a mask, including the adults, the coaches. That is what the CDC recommends. That's what the AAP recommends that as well. Everybody who is an adult and who's there and who's not playing should be wearing a mask if it's very close quarters in like the stands and the viewing areas or on the sidelines. But yeah, I think the biggest rule is teaching your child how to protect themselves.
And even local health departments or your school may have different rules on top of that for sports. To answer that question, some of the areas or some of the schools here in Michigan, even while they are actively playing, they should be wearing a mask. So really being active in your child's school and knowing what's going on, what's being stated. There is another question in the audience that I want to get to, but actually leads to one of our questions that we received beforehand. How soon until children age under 12 will be eligible for vaccination? So when can those kiddos become vaccinated? Dr. Agu, did you want to address that?
Yeah, sure. So that is a great question. They're currently still doing studies right now on the kids that are under 12. So we don't know exactly when the vaccine will be available to those children under the age of 12. We're hoping sometime in the fall. And we know that there are a lot of parents who are really eager to get their child vaccinated. And while that's great, we have to be careful and knowing that with these studies that are going on for the younger children, they are giving the younger ones a smaller dose of the vaccine. So we can't give the same dose that we give to our teenagers and our adults to the younger kids. So if anybody was out there wanting to go to their pediatrician and say, hey, like I need to vaccinate my 7-year-old, no, not yet. We will get a vaccine ready. It just has to make sure it's going through the safest process for our little ones.
I agree with Dr. Agu. The lead for Pfizer, who is actually a pediatrician, just issued some information regarding right now the current age group that is in a study is like the 5 to 11-year-olds, right? That's who we're gearing up to get the vaccine out to next. And like Dr. Agu said, we support this, and everybody else as physicians support this. We are going with what the FDA and the CDC are saying is appropriate use of the vaccine, right? So you cannot give the same dose to children that we can adults. So do not sneak or try to somehow like finagle your way into getting the vaccine early for your child. We want to be safe. Okay, so going back to what the lead researcher said, by the end of October, they're hoping to get some of their data out to Pfizer. I said Pfizer. Lord. Pfizer.
Add a little slang to it.
Pfizer. So from Pfizer, so the FDA could look to approve that, and then even I know in the office, I've had parents ask me about the babies. And again, like Dr. Agu said, everything is studied. We want to be safe. These vaccines have a great safety profile, but that's because we're following the rules. So we can't skip ahead. So the time will come, but the best way to protect your little ones who can't get vaccinated is masking, washing your hands, all that jazz.
I would add to that real quick, just on a more technical note. For all these studies that are looking at kids 5 to 11 years old, so long as they're still recruiting participants, then the vaccine's not coming anytime soon. So long as there's still an active recruitment for participants in that age group, that means they're still studying the best way to get this vaccine to children.
The question that's in the audience, or from the audience, it says, should we be very concerned for high school students who are not vaccinated as of yet? Who would like to take that? Dr. Mel, or wait, Dr.
Either one. Please go first. Dr. Agu.
Okay. So I think that should we be like concerned? Yes, we should be concerned. Should we be more concerned than we have been? I wouldn't say we should be. We should always be concerned about COVID, especially with the people who aren't vaccinated, whether they're high school students or adults or our young kids who still can't get vaccinated. The best thing to do would be to vaccinate those kids who are eligible to get vaccinated, especially with the Delta variant being as transmissible as it is, meaning that it is very easy to go from one kid to the next kid. The best thing to do would be to vaccinate your high school student to make sure that they are wearing their masks, because they for surely can wear their masks. So they should be wearing their masks. They should be washing their hands. They should be social distancing. And that's kind of the safest things that they could do for themselves, really.
Yeah, I would just add, like, I completely agree. The best thing to do is to try to protect all the other people. Have like a barrier of protection, set up for those who could not be vaccinated, and there are various reasons. We don't want to assume that the high schooler themselves, are not trying to become vaccinated, or it could be an issue for them, the parent who's trying to vaccinate. There could be a lot of reasons for that. So we're not trying to put any particular negative implication towards anybody. But if in the situation where someone is not able, or the high schoolers are not able to be vaccinated, just really try to enforce the mask mandate. And then for yourself, for those who are vaccinated, you are protected, but you should still maintain all masking and all the other forms of risk mitigation, because yes, you have an extra level of protection, but there's still the likelihood that you can become infected and pass on the infection. So you just want to do what you can for yourself, in addition to having the person who's unvaccinated protect themselves and others.
Anyone else want to add to that?
Just wanted to add, like, last year, when it came time to sending my kids back to school, when I did not have the vaccine, I was very concerned, especially when the cases were rising. But there's a certain level of security that we can rest in when it comes time to, if your children, particularly high schoolers is what I'm talking about, people who are old enough to have been vaccinated, that really does allow my heart to be a little, or in my mind, to be a less concerned that they are going back to in-person education at this point in time. Again, the vaccines have been 95% and more effective at preventing severe disease, including, and most importantly, death, right? So I think one thing that it takes a little bit of time is with the idea of understanding that the vaccine does offer us a certain level of security for our children who we've allowed and who we've gotten vaccinated, thankfully.
That actually leads into one of our next questions that we had in an audience question. It says, if people who have had both vaccines but are still getting COVID, like Reverend Jesse Jackson and his wife, how are we to feel safe? That's a great question. Who would like to take this? Go ahead, Dr. McPherson.
So we've always, and I mean, CDC and of course we have as YBP have always said from the beginning that the vaccine job is to prevent severe COVID-19 disease, hospitalizations, and death. Not once did we say it was 100% effective and you won't catch you won't catch COVID. We are seeing breakthrough infections and people are vaccinated, but and then once again, Reverend Jesse Jackson and his wife caught COVID. We don't know details about their personal health. I know he has Parkinson's, but I don't know if he has some other underlying issues. I don't know the status of his wife, but even when it said they were hospitalized, it didn't give any more detail. Like, are they in the ICU? Are they on their deathbed? You know, actually, I think the latest update was that they are on a step down, like they're almost about to get discharged. So in my eyes, the vaccine did what it was supposed to do. Right. I guarantee you they would have had a much worse outcome had they not had that, you know, that vaccine protection. So yes, we still need to, we're all vaccinated. We still need to wear our masks. We still need to practice all the safety measures we did earlier. But as of with Delta right now, the hospitalizations, 95% greater are unvaccinated people who are in the ICUs and who are dying. So yes, there are going to be some breakthrough infections. I have a couple of friends who were fully vaccinated, went to some events, was around some people that are unvaccinated, and they found out they were exposed. They tested positive, and guess what? Very mild symptoms lasted a few days. So my eyes, the vaccine does what it works. It will protect you from severe disease, but having it does not give you you can walk out with a Superman S on your chest. It's like, yes, I can walk in somebody's face with COVID and I won't catch it. And that's the main message, that it prevents severe disease and hospitalization and death.
And I just want to add to that.
Oh, yeah, sorry.
Give me 15 seconds. The only thing I really wanted to add to that was the statistics about that. Basically, as of August the 23rd, CDC has reported that there's only been 11,000 cases of breakthrough COVID infections that has required any hospitalizations. In addition, that's out of 171 million people that have been fully vaccinated. So notice that the numerators and the denominators make a difference. And we're talking about less than 1% of in breakthrough infection rates.
I'm so glad you brought it up. I'm a numbers person. So
I pulled out my calculator. I was about to do the stuff.
That
so I'm glad Dr. Janelle already said it. Go ahead.
That comes out to for those who might not be as good at math, that comes out to 0.00008% of people who are vaccinated that test positive. Flip that around, 99.2% of people testing positive are unvaccinated. 99.2%. So yes, 0.08% of people who are vaccinated tested positive. That is a very small number when you think about how many people have been vaccinated. But I get it. I get the media push. The media they'll say tomorrow, I mean, God forbid, I'm not wishing it on anybody. If Beyonce caught COVID, it's going to say, oh, Beyonce is fully.
Did you have to use her as an example?
I didn't mean to. She's the first name that popped up. But if Beyonce was fully vaccinated and caught COVID, that would be the headline. As opposed to, how are you feeling, Beyonce? Do you have any symptoms? You know, it's just going to say Beyonce is fully vaccinated and caught COVID. And that's not right.
Headline. Yep.
So just quickly, look, I just read up, I just looked at the latest information on Reverend Jackson and his wife, and it looks like he himself is in a rehab center getting therapy, probably related to his Parkinson's. And then his wife, looks like she was not vaccinated and she's in the ICU. So you can see the difference of getting the vaccination versus not getting the vaccination, and kind of which direction people are going. So
very, very good. So the next audience question, I feel like we've answered this a little bit, but I want it to be very, very clear. It says, what type of mask do you all recommend? Should it be a type of material, cloth, disposable, in the minimum number of layers? that's also a question mark. Thank you.
So
Is that for when it comes to kids or just in general? For
I think that's in general.
Um,
But we can answer it either way.
So I can answer for just children, being the pediatrician. So I think any mask a child will wear, you should just let them wear. If they're like, you know what, I feel like wearing my purple cloth mask today and my orange surgical mask tomorrow, whatever, just let them do it as long as they have a mask on. I guess our adult doctor friends can elaborate more on the just adult masking.
I know Dr. Lee Allen had a statement, but I'll just follow after.
I'm sorry, just for the peds to piggyback with Dr. Agu said, whatever you can get them to put on their face, fantastic. Sometimes some parents come in the office and they ask me, should I get an N95 for my child? Remember that those masks are actually fitted for our face. So children under the age of 6, that's not going to be useful for them. What mask you pick, it should be able to firmly like on their face. Okay, it should cover their nose and mouth properly. So if you get them a mask and it's just like this, it's not doing its job. Okay, they just look like their nose is playing peekaboo. So you need to have a mask that provides a proper seal. Okay, but in terms of the little ones, especially if they're going, I know Dr. Urota can speak to this. If you're going back and you have a 5-year-old, you make it fun. Make it something they can participate in. Let's decorate our masks. Let's put a unicorn on. Okay.
Yep. His class had done that. They just had a session where they had the cloth masks and they just had a bunch of arts and crafts and decorated them. And that encouraged, something for them to take a little joy in wearing them. And I can, as soon as you said that, Dr. Agu, about whichever one they can wear, because I know that my son hates the disposable paper ones because he gets them all wet really fast, but he likes his, Avengers cloth ones, his Paw Patrol. So, they let them have that autonomy in picking and choosing the colors, and make it something fun. That will get compliance much easier.
I had a question for the parents in the group. Just like, do y'all have also like starter kits or little kits for them? Like, I don't know, COVID kits, like for them, like hand sanitizer or anything else?
My daughter, she has, of course, she carries her little backpack with her name on it. And she has a couple Elsa and Anna frozen masks, and she has a little small like handheld sanitizer. But once again, it comes with just she sees me do it so much to where it's clockwork. Me and her, we go to the park, and as soon as we get in the car, she's like, "Daddy, I need the sanitizer." Like, it's embedded in her. She knows that she was just playing on all this, playgrounds, the playground thing, toys, whatever, and swings, and she's like, my hands are dirty. Even as soon as she get in the car, before she grab a snack or water. So and a lot of that was just her watching me. But she does have, she doesn't like the disposable mask as much either. But yeah, she does have her cloth mask in her backpack. She has a little sanitizer, and she understands what she's for, but she understands what COVID is. She understands it's serious. She's like, "Daddy, we can't go over there because of Corona." Like, she gets it. I mean, I hated that we have to explain that to our children at such a young age, but I mean, she's doing well with it.
Yeah.
I want us to move on to the next question.
I just wanted to, I hate to drag that one out. I just wanted to add some specifics because the CDC does have their own recommendations. I got you. This one is important. I'll put a link actually into the chat room, the chat box. But essentially, you want to, all of what was already said, the aim for like fitted ones. If you're actually looking out, if you can't get surgical masks, because there are some that are like been cleared by actual studies. But for cloth masks, you generally want to go with the ones that are better fit. Do tie, not the loop. The tie, which you can tighten. It helps to get a better seal. Find one with nose wire inside of it so that you can actually brace it down over the child's face. Avoid any ones with the valves or the vents or anything like that. and aim to go for ones with multiple layers, like three layers of filtering in them. So those are the things you want to kind of look out for. But essentially, as you get the younger in age, you just have to try to get whichever they can tolerate. All right, and I'm gonna drop a link in here so that everyone can get to that.
And I'll just quickly add on the last part.
Go ahead.
I'm sorry. I'll just quickly add that if for as far as cloth masks or practical, trying to figure out how many layers are in it, if you're able to blow out a candle, like imagine a candle, trying to blow it out. If you're able to blow it out, it means there's too much filtration, it's too wide open, it's not a good mask. But if you can imagine trying to blow out a candle and you realizing there's nothing getting through, then you're probably on a better side of wearing the mask that you have. You can keep that.
Okay, those were two great points.
All
Both
right.
about that.
Thank you.
All right,
Thank
we're
you.
good.
Thank you.
We're
Thank
clear?
you.
Okay, good.
Okay. We have someone in the chat who's been waiting very patiently. It's a little bit off of our Pete's talk, but she's been waiting. So it says she's in one of the many states that's in high alert. Her issue is that she has cardiomyopathy. She's hesitant to get the vaccine. Who would like to take that?
Right as of now, the main contraindication is I think we were discussing this earlier, if you've had a history of adverse reaction to the vaccine. But this vaccine has studied this. They've had people with a broad spectrum of comorbidities, diabetes, heart failure. They've even had people with some autoimmune diseases such as lupus, rheumatoid arthritis. So I would say, especially now that the vaccines are FDA approved, which basically just kind of goes to show that research proved even more that the vaccine, the risk outweighs the benefit, and that they are safe. I would say that cardiomyopathy is not a contraindication to receive the vaccine, but more importantly, you should have this conversation with your primary care provider, and just kind of just go over, your concerns, special concerns. I have cardiomyopathy. I want to know if the vaccine is safe for me. What side effects should I expect? Would I expect anything different than a reported side effect? So ultimately, this is a conversation with your primary care provider, but I can say that they have studied, heart failure, diabetes. They have patients in those trials, and those patients receive the vaccine and they're doing fine.
And I have the actual contraindications printed off from Pfizer and Moderna. I'm just going to read the Pfizer one because they actually pretty much say the same thing. Who should not, in all caps, get vaccinated? If you had a severe allergic reaction, which is anaphylaxis, or an immediate allergic reaction, even if it was not severe, to any ingredient in an mRNA COVID-19 vaccine, such as polyethylene glycol, you should not get an mRNA COVID-19 vaccine. Or after getting the first dose of the vaccine, you should not get a second dose of either of the mRNA COVID-19 vaccines. Under that, it says an allergic reaction, and they give you the definition, is considered severe when a person needs to be treated with epinephrine or an EpiPen, or if they must go to the hospital, okay? And then they also go into what's an immediate allergic reaction. That means a reaction within 4 hours of getting vaccinated, including symptoms such as hives, swelling, or wheezing, which can lead into respiratory distress. So really, like Dr. McPherson said, you should talk to your physician, but a lot of people, and I'm sure the family medicine doctors can attest to this, you are probably someone we worry about the most. You are part of the vulnerable community, okay? I worry about if you actually get COVID, what would happen? But Dr. Yeroda, I'm sorry, you were about to say something.
No, that was exactly my point, was, just considering the risks. The studies fully support this, that your risk of something detrimental happening if you actually got COVID versus having a adverse serious side effect of getting the vaccine, the numbers are not the same. It's a stark contrast that you are in a much more serious situation by getting COVID naturally without that vaccination protection.
Very good. We have another audience question that I think, Dr. Guinea, this will be great for you as the OB-GYN in our group. The person said, I am a teacher currently pregnant in North Carolina. I'm not vaccinated because I was unsure of how that would affect my pregnancy. I am planning on getting it once the baby is born. Currently, I have students who are quarantined, some who have positive COVID test results. Any advice to stay safe before I go on leave in October?
Well, definitely, that's an excellent question. I think the most important thing would be, first of all, get the vaccine. The American College of Obstetrics and Gynecology, which is the governing body for all obstetrician and gynecologists, the recommendation now is to actually get the vaccine. You know, before it was, all right, talk with your physician, but all physicians by and large that are obstetricians, whether you're a fertility physician, you're a urogyn, or any of those physicians that fit underneath that purview, the recommendation is to go ahead and get the vaccine. It doesn't affect it doesn't affect female fertility. And I think Dr. McPherson can also speak a little bit about male fertility later on. But all the data that we have shows that COVID-19 is actually more detrimental during pregnancy than getting anything of the vaccine. So the vaccine's protective. Get the vaccine. Wear a mask. Follow the 6 feet guidelines when you're up in close proximity with your students.
Perfect. The next audience question says, this is from Mr. Jerry, with schools back in and outbreaks being observed, do you feel it will accelerate development of new virus strains? Dr. Fletcher, you want to take this one?
Yeah, I'll take a swing at it.
All right.
So if you think of COVID as a brush fire, the more unvaccinated people there are, the more the virus has an opportunity to go from one person to the next. And as the virus goes from one person to the next, it has an opportunity to mutate, to change, to essentially evolve. And the more it does that, the more potentially lethal it can become. And that's how you can see whether or not the virus can become deadly. And so, same way in a brush fire, if you can take away the fuel that the virus needs or the fire needs, then it has no place to go, it has no place to evolve, it has no place to mutate. And so the more people that get vaccinated, the less there's opportunities for other variants to evolve. And so, just to answer the question, can it become more lethal? Yes, but if people get vaccinated, it really reduces the opportunity for the virus to do that.
Very good. Very, very good. Anybody like to add to that before we go to our next question?
Yeah, I think I just want to add to that. Viruses do exactly what they're supposed to do, which is to grow and to mutate. So the same reasons why we said initially the most important thing, and that gave us hope from the very beginning in December when we started this, was the idea of being able to have a vaccine that would allow your own immune system to be able to quickly attack and coil any COVID infection that you may come into contact with. Because the more people who have the vaccine, the more that we have hosts that are able to quickly shut down the COVID virus so that it cannot mutate. So folks who are unvaccinated essentially are in a situation where COVID can wreak havoc and COVID can do everything it needs and wants to do, including mutate and then be passed on. That's how we got the Delta variant, and that's how we'll continue to get more until we can get to a point that many of us, over 70%, or at least 70% of us, are vaccinated and can keep up with these variants that get created year by year.
And I know, Dr. McPherson, there is a question in the audience. This will lead us to our next one. But it says, can you address the third shot? And do you think one would feel the same symptoms as a second? Low-grade fever / chill over a short period of time. What do you guys think? I know we were talking about boosters. What are the boosters? All that jazz. Go ahead.
So as of August 15th, that's when the CDC decided that a third booster would roll out. Initially, though, it's for those who are most vulnerable, the immunocompromised. And of course, with FDA and CDC's blessing, they said as early as September 20th, they will start to roll it out to those who are not immunocompromised. But once again, taking the people who would probably get it first, because it has to be 8 months. They also say 8 months after your second dose. So that dates back to the first people who received it, which was the most vulnerable, our nursing home residents, our healthcare workers. Getting the booster is not to say that the vaccines don't work, the 2 shots don't work. They're kind of being proactive. Like, they're seeing that our vaccination rates isn't going the direction we need to. I think it's still only 52% of the population is vaccinated, which, as Dr. Fletcher was just stating, there will be more variants because of this. We still have a high percent of the population that's unvaccinated. So, and we're also seeing a lot of breakthrough infection. So this booster is just going to give you that much more protection. They're seeing after about 8 months, you're having some waning antibodies in the blood. Doesn't mean you don't have any protection, because there's more to the immune system than just antibodies. You have, I don't want to get too medical sciencey, but you have memory B cells and memory T cells. These cells, the key term in their name is memory. So when you get exposed to the virus, it could be 2 years from now, those cells will remember, oh, I remember this. And those memory B cells and T cells will try to neutralize it. The B cells will produce more antibodies and attack the virus. So it's the circulating the circulating antibodies is what they're seeing that kind of wanes, and they just want to give that extra protection. I was reading something a couple of days ago, and they were saying that you would probably experience the same side effects because you already have some protection. So just like on the second shot, you kind of had those mild expected, fever, some mild chills, body ache. You would probably expect you can expect the same symptoms with the booster. But once again, the overall in this is that those symptoms they are very short-lived, and they are nowhere near what you could experience if you caught COVID. And something that doesn't get talked about enough, and I'm sure a lot of us are seeing this, even you, the pediatricians, is long haul. If people who have had COVID last year are still having symptoms. So when people ask what are the long-term effects of the vaccine, we can't 100% tell you. They are following the people in the trials. I always tell people when they say what are the long-term effects of the vaccine is protection against severe disease. But the getting COVID, yes, the possibility you can get it and you clear the virus, you don't have any symptoms afterwards. But a lot of people, they're opening up long hauler clinics because people who have had COVID are still experiencing shortness of breath. People are on blood thinners now. People are still having memory fog, just body aches. So the booster, you'll probably still have some of those expected symptoms, but like I said, it does not compare to what you can potentially experience if you caught actual COVID.
And I Dr. McPherson, just because you mentioned it, the long COVID is, what they're calling it. Yes, we do see that in children and teenagers. I had one teen who and some other family members caught COVID, and he was out of school for 5 to 6 months. The effects that it has on these teenagers, not only just like physical, but the mental and behavioral effects that COVID's had on our teenagers and just children in general, we can't ignore that. So when people say kids, they don't get that sick, or it's not a problem with the kids, or why do we need to worry about it? It is a problem for our children. They have been suffering. The suicide rates that we have been seeing, they have gone up. The rates of eating disorders have gone up as well. So it is a problem. But anywho, I want to get to the next audience question because it leads into another one of our questions. I know we talked about this beforehand. should children still get the flu shot? So Cosette Livis, that's actually my cousin. Hey, cousin. Anywho, she said, if I can get the booster, do I still need to get the regular flu shot? I think too many people think it would be overkill. I plan on doing both. Can I do the same day, or do I need to spread it out? What are you all saying? So two-part question.
I think it would be a great idea to also get the flu shot. Studies do show that there is COVID protection by getting the flu shot. So especially I feel for our young ones that still can't get the COVID vaccine, it would be really important to have some type of, protection, and that could be offered through the flu shot.
And the second part, so can she get it in the same day? Does she have to spread it out? What's that?
The CDC recommends that you can get it all in the same time.
Right.
So you do not need to spread it out. This has been looked at closely, and right now they've suggested do it all at the same time, or you can.
They're actually working on a vaccine that has both flu and COVID together to give simultaneously. So that should be hopefully coming out soon as well. I believe is the company that's working on that, but that one is in process.
And I want to also add to some of the things that you guys are saying, which is this. As healthcare providers, we get flu shots year in, year out. Again, it doesn't necessarily 100% protect you from getting the flu for the very reasons it decreases your chances of getting the flu. But, for the very reasons that a lot of the other physicians on this, this Zoom mentioned, is the other thing is like washing your hands as well and doing the other precautions. All of those things will help decrease the chance. And a lot of the reasons that we didn't see as much flu last year was because we were wearing masks, we were washing hands, and doing a lot of the precautions that we're talking about.
I didn't diagnose any flu last year.
Yeah, my office ran out of the flu vaccine. We were getting it so fast and so, much, which was great, but that had never happened before.
You have to remember now we're more out and about, right? So people are mingling again. So I think that because we have been in this terrible episode of a show called COVID for so long, people think that other viruses are not out there, and they are. So in the PEDS office recently, we have seen a surge of RSV. RSV, for all the pediatricians out there, we know that's a fall and winter virus. We used to always, Dr. Agu, and I did residency together. We used to always joke winter is coming, right? Just like if you like Thrones, winter is coming, because RSV is known to come. RSV is here now. Where was RSV hanging out? I don't know. Okay, but now that the kiddos are back at daycare, they're back at school, RSV is I missed
time to play.
Let's go. And the fear that pediatricians have is that flu is sitting there I'm ready, let's go. So still get your flu shot because, these other viruses, they, especially for those who have, certain conditions like, myself, an asthmatic, I'm going to get my flu shot because everybody has said on this panel, the purpose of vaccines is that it acts like a seatbelt. Just because I think I'm a fantastic driver, okay? I think I'm awesome. But that doesn't mean that I'm going to go out on these Detroit streets without my seatbelt on. So put your seatbelt on, because God forbid if you get in an accident, that's going to protect you from complications. And one of those, the worst case scenario, death.
Yeah. What's that commercial that used to say, don't be a crash dummy?
Yeah, essentially. So that's something to remember. We have another question in the audience. So if elementary children can't be vaccinated yet, and you have schools with very little parental involvement, why should we send unvaccinated children to school? Can't the virus still mutate in children? This audience member is a little confused. So can someone clarify?
I can try to clarify some. So that is true that the virus can mutate in children. When you are mentioning why should a child go back to school if they're not able to be vaccinated? We believe that the kids need to get back into school because they do better in person. They learn more of their social skills while they're in person with their classmates. For those who can't get vaccinated, the safest thing that we did mention is vaccinating the teachers and the staff at the schools and making sure the kids are washing their hands, having that hand sanitizer, and trying to keep their mask on. I think it is that's a really valid question, but I think it would be best for them to be in school just so they can be around their peers and kind of have a good learning environment, I would say.
So I agree with Dr. Agu. And what I know the American Academy of Pediatrics has been saying exactly what Dr. Agu was saying, but also it's very important to recognize what we have noted, that when you are in a controlled scenario or situation, right, and you are using the universal mitigations and measures that are recommended and put in place, the children they're not having as much the transmission rate is the same as it would be out in the community. So they need to go back to school, but your school that you're sending your child to needs to have those proper measures put in place. So wearing the mask, washing your hands, making sure what are you doing again, so that we can stay 3 to 6 feet apart. So I know Dr. Uroda has touched on this, and other panelists have. Some kiddos, what some schools are doing, they're separating out in pods. So they're splitting the classroom, and they're doing certain activities separately so they can try to put those in place and making sure the children wear their mask. But at the end of the day, it comes down to you talking to your pediatrician about your individual concerns, because each school may be different. How can I advocate for my child the best way I can, because this is what's going on? Anyone else want to add to that?
Yeah, I would also, if it's something that you're still not comfortable with as a parent, to do a little research into different schools, or maybe even the one that, your child would be expected to attend, because I know with my son's school in particular, they offered the choice. They offered virtual learning as well as in-person class. People the opportunity to have an option that would make them feel comfortable, or work best with their schedules. So if that is something, just know that there are opportunities that might not be directly, a little alternative type of options, but they're out there.
Right. And I think too, I'm not a parent, but, kind of hearing some of these things anecdotally from other parents, we also understand that not a lot of parents may have those resources, or the schools themselves may not have those resources. Like, for example, computers, some places have computers where there can be virtual learning. Some of them may not. Some of them may have these recommendations that we're giving you. They may not have all of those resources to provide for your child. So that's where I think where Dr. Johnson and Dr. Uroda and then Dr. McPherson, as well as Janelle Lee Allen, were mentioning, that's when you need to go talk to your superintendent, the school board, or someone, and then kind of also take it upon yourself to kind of start doing those things and take control of your household in terms of providing that security that you need. Because at the end of the day, it's our responsibility to protect our children.
So the next audience question says, if a child gets COVID, do they still need to quarantine for 10 days, or does it depend on the state guidelines? Who would like to take that?
I think right now, if a child does get COVID, they do have to quarantine. Yes, I think that's the most recent updates for right now. If a child does have COVID, then they will have to quarantine for 10 days. And I believe that some schools are saying if you have the vaccine, if the child had the vaccine and then was exposed to COVID, then they won't have to quarantine right away, but they will have to wear a mask. So that's kind of different. So if they're exposed, it's one thing versus if they have it. If they have it, they have to quarantine. If they were exposed, they might not have to quarantine right away, but they will definitely have to wear a mask in the school vicinity, on the playground, everywhere.
Dr. Lee Allen, do you want to answer that?
Yeah, so CDC has said if you are fully vaccinated and you get exposed, that you need to wait roughly 3 to 5 days just to make sure that we don't test you too early. And it just so happens that we can't pick it up on the test. There is an incubation period. Afterwards, 3 to 5 days, if you are fully vaccinated, you've been exposed to someone, essentially, if your test comes back negative, that's fine. You do not have to quarantine. However, if your test comes back positive, just like anything else, you do need to quarantine. You do need to inform either your primary care doctors, and usually the place that you're going to test at will take care of all of the notification processes, because there is a contact tracing in place. I know for the older children, it's the same thing, because the schools will have to contact those people who are in the cohort with your child, so that they can all quarantine, essentially, or test. Because if the high schoolers have been vaccinated, and they've, found out that one of their people and members were COVID-19 positive, they would follow the same rules. Wait for 3 to 5 days, get tested. If the test comes back negative, they will be able to come back to school because they've been fully vaccinated. If the test comes back positive, they will do just like anyone else. And it doesn't matter if your child has symptoms or not. So let's say if your child says, "Oh no, I'm feeling just fine," it doesn't matter. On that third day, go ahead and get them tested. And in between the time that you get that you've gotten your negative test back, then you will need to mask everywhere that you go, indoor as well as outdoor, so that you're not exposing anyone else to something that could be brewing.
There's another audience question. It says, so how concerned should we be about the COVID risk amongst preschoolers during nap time? Since it's not advisable for children to wear masks while napping, if the appropriate precautions are in place of adequate social distancing and children sleeping head to toe. So basically, who would like to take that?
I can speak personally that my son was, prior to him now going into kindergarten, they had nap time and they would just social distance the cots. There were no cases in his class from the time that he had been. And they also didn't wear masks during lunchtime. And then also keep in mind, this is a group that, does a lot of lack of social distancing. They're not thinking about that stuff. I think it really boils down to our community protecting, our kids. Us making sure the teachers were vaccinated, the parents were vaccinated, being closely mindful of all of the germs. And if there was any type of runny nose or, they had stricter guidelines as far as if the kid looked a little sick, you had to take them home. There's a higher threshold and sensitivity for those things now, which I think protects and allows us to, be more comfortable with knowing at nap time, it's definitely not safe to have a mask on for a child that age. That would be something I would not recommend, being safer than the risk of getting COVID.
I would also follow that up with, on the physio side of it, is that, your decreased breathing when you're sleeping. The kids aren't talking to each other. They're not coughing on each other. So nap time is probably one of the more safer times, for your preschoolers or young, pre-K kids is in that, nap time window, because they're not doing all the normal activities that they will be doing, hanging on each other, playing with each other, talking to each other, So I actually think you're on a slightly better safety side of the question when kids are napping.
Very good. Very good. The next audience question asks, is there an RSV vaccine? And as a pediatrician, I can tell you no. There's no RSV vaccine. There is Synagis, which is not a vaccine. That is not a vaccine at all. And Synagis is meant for premature babies, premature infants who are at risk of severe infection. But that is more of, I'm like, how would you describe an immune modulator? Like it gives antibodies, right? So I'm trying to think about how to actually explain that to the group, but it's not an actual vaccine.
There was, you're there. Yeah, there is no RSV vaccine. They tried to do one in the 60s, but what they saw was the antibody dependent enhancement, which basically is what we don't want. All vaccine, that's like the biggest fear for all vaccine companies. That's basically you give the vaccine and the body makes the antibody, but the antibody, instead of neutralizing, it's like non-neutralizing, and it actually makes the virus or whatever target pathogen more susceptible to infecting you. So that's and then they shut it down. But they did try to do an RSV vaccine in the 60s, but it wasn't successful. And then I think they just kind of stepped back and just said, this is going to be an endemic virus, like Dr. Johnson and Dr. Agu was saying. The winter it's a set season that it happens. When they weren't seeing, they probably did statistics and like, well, kids aren't simply dying. I mean, the rates. So they just kind of halted trying to create a vaccine for it, at least from what I was researching.
Yeah, and Synagis again is, like I said, the premature infants, and I was just on their website. It's giving them the actual antibodies to help protect them, so it's not the same thing, but yeah.
I could even just the difference between the Synagis, just as what everyone essentially said. Dr. McPherson mentioned that there were attempts to make a vaccine, but there is currently no vaccine available, as Dr. Johnson was mentioning. What there is that they have available is what they offer is for passive immunity. This is something that doesn't get the body to work up and create, you get your immune system working against the RSV. This is what vaccines do. Vaccines basically just like let the body practice. It practices to get ready for the real thing. This doesn't necessarily do that. This just helps to try to remove any particular virus that may be in the system or prevent it from coming into the system. So that's the difference. So we do need to do all the things we need to do for mitigation, just like we're doing for COVID or RSV and flu and all the type of respiratory viruses.
And I'm looking at the chat. It looks like there's a new question that just popped up from Miss Pennant Smith. Hi, my nephew has COVID. He was quarantined for 14 days, then retested and still has it. He is 10. Please explain. Does anyone want to take that one?
So, I could speak on that and anyone else can jump in. He was in quarantine for the full 14 days, and you're saying that he still has he's still coming up positive. So one thing I need to know is he symptomatic still? Is he not symptomatic? Is he asymptomatic? He doesn't have any symptoms. If he had it from the beginning, he got better. Those details kind of matter because an individual can potentially still have virus in their system, but doesn't necessarily mean that it's live. That means that it's not something that they can pass on, and it can cause another infection in somebody else. It can basically, when the immune system finally does eventually get to working, overtakes it, it will stop it and neutralize it from being active, but you'll still have it in your system. And so those can be picked up for a bit of time. And depending on where you're testing, it could be testing from blood, testing from the nose, testing from feces, because sometimes it also goes into feces. It can be there for a particular period of time. I think more so in feces, it lasts up to a month. It lasts several weeks in the nares, the nostrils. So then it doesn't necessarily mean that the person is infective, meaning that they can pass it on. So I would kind of, at that point, go based on symptoms, but also look to retest at a later period. Okay, so if he's not symptomatic, then the best thing to do is just he can go about his I would assume best is within caution, allow him to be masked and do all the things that he needs to be doing to protect himself from others and protect others, but also retest as well.
Yeah, I would
And I
also.
think that's,
Oh,
go
sorry.
ahead.
I would also piggyback that, when we're talking about symptomatic versus asymptomatic, if you're, I think he said he's 10 years old. If your 10-year-old is back to himself, if he's back to being his normal 10-year-old self, then chances are he's no longer symptomatic. And again, you just want to make sure, you mask up, and, if retesting is just nothing more than just confirmation that he's no longer has the virus particles kind of floating around. But you also want to make sure, what test you're getting. You don't want to make sure it's not an antibody test versus an antigen test. But at the end of the day, if you quarantine for 14 days and your 10-year-old is back to being his 10-year-old self, then it's a pretty good sign that he's on the right path, and he's going to be okay.
And I would just add to that, because we know that this happens and this is common. So I also don't want you to think that your 10-year-old is absolutely somehow, not normal. Know that this can happen with a certain percentage of folks, so it's okay. The biggest thing will be to talk to your particular school to find out what is needed in order for him to return to school. And then, of course, talk to your primary care pediatrician to be able to give more information or possibly provide a letter to the school to be able to help in any situation and offer clarity as to whether he's infected or not infected, and just kind of give them a little more guidance.
So that, thank you for that question. That leads into one of our other questions. So why should I still get vaccinated if I've already been infected with COVID? Anybody want to take that?
I'll take a shot at it.
Okay.
First and foremost, when someone says they've been infected with COVID, it really, you don't know if it's mild symptoms, what kind of response your immune system has built up against your COVID, against your infection. If you had mild symptoms, there's a chance that your immunity to it may not be as robust as the vaccine. The reason the vaccine is great at what it does is because we know that it elicits an immune response that is very high, that is very robust, that essentially gets all the things that you need in immunity going in your body. Now, if you just happen to get infected with COVID, you may have had a mild response. You don't know if your immune system has really ramped up or built up the immunity that it needs moving forward. So there's an unknown with just getting COVID or even mild symptoms of COVID versus the vaccine, which you know what you're getting, you know the type of response you're supposed to have, and you know moving forward that you're going to be protected.
To piggyback, I agree 100% everything Dr. Fletcher said. When you get natural infection, you get more broader. You're seeing a whole virus. You're seeing a whole virus. The virus has 29 proteins with 4 major structural proteins. You're making antibodies to everything, which could be a good thing, but you could also be making antibodies to proteins that basically are irrelevant, that don't mean anything. And but when the vaccine is specifically for the spike protein, which we know that's the protein that causes it to be able to infect cells. So like Dr. Fletcher was saying, that's more focused. You're going to get a more robust response, and you're making millions of antibodies to that spike protein. And when it's chopped up, I know I'm getting into a little physiology of it, is seeing all different variations of the spike protein, which is why we up until this point we've said, even though you're vaccinated, against variants, it's still as long as the variants are to, the mutations are with spike, you should be okay. But yes, when it starts mutating to other structures on of the virus, that causes concern. But just look at it as, when you get a natural infection, you're seeing the entire COVID molecule, which I'm sure a lot of you guys saw the picture. You're getting everything, as opposed to the vaccine. You're getting that specific protein that is causing infectivity, and that's actually causing disease.
Very, very good. We have another, well, actually, before we move on to our other question, we have about 9 minutes left. We just wanted to launch a poll. It will pop up for you all. I think we just did it, right? So if you could answer some of those poll questions for us too, while we're still wrapping up and answering questions for you all. So we have a question from the audience that says, why aren't we doing throat testing instead of nostril testing like other countries? Anyone want to answer that?
Let me just make sure I heard that. Was it, why are we not doing throat testing?
Yes.
Oh, well, what we know is that based on the virus, we're trying to capture virus particles, essentially, when we do any type of swabbing or withdraw of blood or anything, we take any samples. And so we see with previous studies that when they compare the different areas, when they sample them, they're relatively essentially the same in terms of how much you can get of the virus. And so we really just want to go with, if we can get them all the same amount of the sample from different areas, we just want to go in the area that's least invasive. And so it's just better to go through the nose, than going all the way back into the throat, because it can lead to hacking. It's intolerable for certain groups. So that's just why it's a little bit easier. But there's no necessarily extra benefit from going through the mouth than going through the nose.
As a pediatrician, it is much easier to get a nasopharyngeal swab or, by the nose versus getting the throat swab. Trust me, when I have to swab children for strep, children turn into the Hulk. Like they get these super strengths and they're like, ah! Am I going to and you want to get the best sample, like Dr. Amel was saying, when you are doing this, because we don't want to, it's difficult for parents to put their children through that. It's hard for parents to watch their children being tested. So I want to make sure that when I do this, I do it well and get the sample I need. Okay. So if they have snot all over the place, it's a lot easier for me to have the parent hold them a certain way and get into the nose. Just speaking from experience. Okay. So, since we have about 5 minutes left, are there any closing statements, that some of the panelists would like to make? Everybody jump at once.
I could just say thank you guys all for coming and participating and asking great questions. I'm sure some of you are already vaccinated, so we applaud you for being vaccinated. And just make sure you take the information that we provided you guys with and share it with your family members and your reluctant teenagers or college children about the virus.
Yeah. I'll just jump in. I'm glad to have you all, the attendees, present with us. I'm glad that we can have this opportunity to share, all the things that we've been absorbing and learning and picking up in our own, various practices and in our field. And, we just want to make sure that everyone's informed, that, you have the best information available to you to make the next best decision. And we wholeheartedly stand by you getting vaccinated and protecting yourself as well as the people around you. And if there's still further questions or concerns that you have, do not hesitate to ask us. We will leave our information in the links. Connect with us. We have a lot of different mediums. And so stay with us and, we'll continue to do more panels and have opportunities for more connections with the public abroad.
Just to answer one quick audience question before we all finish closing statements. It says, have all these doctors been vaccinated? The answer is yes. All of us have been vaccinated. Just as physicians, we take it very serious that we are the leaders of our community. So we would not be endorsing or telling you all to get something, one, if I haven't even gotten it myself, and two, as a pediatrician, I tell my parents, I would never, ever put your child in harm's way. Okay. For the children who can get vaccinated, I'm not going to tell you to do something to your child that is going to cause harm. So at the end of the day, I know that we all take it very seriously, our role in the community, and we're very passionate about that. We all come from different backgrounds and specialties, but that's how this all came about. We wanted to make sure that you all were well informed, not misinformed. We wanted to make sure that especially our marginalized communities saw people who looked like them, and that you all were able to come to us and ask us questions. So like Dr. Mel said, we have tons of panels and they are on our YouTube. We have Instagram. It is called Young Black Physicians of Detroit. Young Black Physicians of Detroit.
Or Young Black.
Just Young Black Physicians.
Just Young Black Physicians. Okay.
Yeah. Period.
I'm retired and over 30, but sometimes. But anywho, you can find us on Instagram. You can find us on YouTube. And like I said, what's our shared goal is really to educate our communities while we work to dismantle systemic racism and its effects on patient care. That's why we came together. That's why we take this so serious. I guess that's my closing statement.
Yeah.
Mel and what Dr. Johnson said, they basically just said everything I would have said. But like I always told y'all earlier, I'm a numbers guy. Last I checked, 94 to 96% of physicians in the United States are vaccinated, which I thought it was less than that, but according to data, yeah, that's how many physicians are vaccinated. So, but like Dr. Johnson said, we are all look at ourselves as leaders of our community, so we wouldn't promote anything that, like you said, we wouldn't take or we don't believe in. So, we hope you guys take this information and, like, Dr. Agu said, share it. Go to our Facebook, Instagram page, and if you got any other questions, just ask us. We understand your trepidations and hesitations. No judgment there. But like you said, we're here just to give, information and not misinformation. And we do a lot of debunking myths too. We ain't really get to it today. That's one of my favorite things to hear.
Yeah, mine too.
We debunk a lot of it.
Instagram and stuff.
And then we only have 1 minute left.
Yeah, and so I just wanted to thank everybody again for joining us. Keep an eye out. Again, like I said, you check our YouTube page out. We have a number of different talks about different topics. I mean, we're talking about COVID right now, but we talk about other health conditions like endometriosis, and it's called Black Docs Talk. You will see our lovely twins, Dr. Agu and Dr. Johnson on there. As well as some
real twins actually in our group.
They're actually not twins.
Yeah, we do have actual twins as well.
But you'll see a number of us on those talks. So definitely keep an eye out for us on those different mediums. And if there's questions that you didn't get a chance to answer or topics that you want to find out about, or if you just like to partner with us on different projects, reach out to us. We'll put our email in the chat as well, so that you can reach out to us. We do a number of different things like education and training, which is a huge aspect of what we do. So think about us when you think about those projects.
Thank you again tonight for joining us. Peace and blessings.
It's youngblackphysicians@gmail.com is our email. Okay. All right, you all. Thank you again for joining us. You guys have a great night. Stay safe and stay healthy. Thank you.
Thank you.
Bye.
Thank you, everyone.
Oh, thanks, Dad. He's proud of us. My dad said he's proud of us.
Thank you, Dr. Johnson.
My sister was in there. Thanks, fam.